What we're wanting to answer is what are the key actions or priorities that need to be taken if we want to improve the lives of adolescent girls. I'm going to focus on adolescent girls in the context of sort of Bangladesh. I mean, adolescent boys are also vulnerable, particularly from poor households. But if I look at adolescent girls or those who live in poor income households or in slums, poverty is a huge challenge. And although a lot of the discussions talk about socioeconomic status or economics as a variable, the reality is if you go to informal settlements, Dhaka is an urban megacity. You have 1,000 migrants coming in every day. You've got the largest number of settlements, informal settlements, in Dhaka city. And you see studies, you see correlation both qualitative and quantitative between, young girls getting married early because of poverty, because they can't afford to go to school, or because they have to work to earn an income, or you have young girls getting married early because there's crime and insecurity, there's lawlessness. For me, poverty is a fundamental kind of challenge. And if we're going to look at the most marginalized and vulnerable groups, we need to address poverty, because with poverty, if you address that, you also address basic services. You address issues of basic housing, water, sanitation. It also brings in the questions of social justice and the basic human rights of every individual. And adolescent girls are particularly vulnerable. If you get married early or if you are sexually harassed, you have a whole sort of consequences of stigma, shame. You also deal with early pregnancies, miscarriages, maternal morbidities. I think that we need to have a comprehensive approach to health and the way we understand development. So I'm very sort of excited by the SDGs, but where it takes us, unless we don't actually invest resources and recognize that poverty is a fundamental underlying cause of many of these drivers, which adversely impact on adolescent girls and even young boys, we are not going to see much change. To give you a particular example of, I've seen endemic deprivations or uncertainty affect adolescent girls' lives. I remember during one of my fieldwork periods, the entire slum was evicted because they have insecure tenure, so it can be removed at any time. One young girl was pregnant. She was a newly married adolescent girl. And because the slum was evicted, all the couple of clinics that were set up by the non-governmental organizations were demolished. She ended up getting a clandestine abortion, was bleeding, had complications. I mean, there's so many cases where you see endemic poverty, impact on people's lives and their choices and constraints. And adolescent girls are particularly vulnerable. And to a certain kind of, challenges. I want to add adolescent boys, because you see a lot of adolescent boys who are joining gangs. There's a lot of drug use, there's lack of jobs, there's lack of skills, higher dropouts. So, this is a problem of poverty. And this is something we need to recognize if we're talking about leaving no one behind. A much more reflective understanding of what it means to live the everyday realities of some of the most vulnerable in our informal settlements.